Welcome to the Health for a Change, a series from the Foundation for Healthy Kentucky that has supported nonprofit and health leaders across the Commonwealth in their work to improve the health of Kentuckians for a decade. Today, we focus on public health transformation. I am Allison Adams, Vice President for Policy at the Foundation. Before we introduce our speaker, a quick note about us. The Foundation for Healthy Kentucky works to address the unmet health needs of Kentuckians by developing and influencing policy, improving access to care, reducing health risk and disparities, and promoting health equity. We are a nonprofit, nonpartisan organization funded by an endowment that works to create communities where people can achieve their best possible health. We work to advance policies that foster health equity and amplify the voices of Kentuckians who have historically not been part of the decision-making process. Public health transformation helps us reach the vision because it provides equitable public health systems funding across the Commonwealth. Joining us today is Jan Chamness. Jan is the director of the Kentucky Department for Public Health's Division of Women's Health. She was asked by Dr. Stack to take a lead role in public health transformation. Jan has spent nearly 25 years in public health after having served as the public health director for the Montgomery County Health Department prior to coming to the Kentucky Department for Public Health in 2019. We are excited to hear from Jan on how Kentucky's public health transformation is going. Please write your questions for Jan in the chat box, and we'll address them after her presentation. Welcome, Jan. Glad to have you.
Thank you. I'm going to go ahead and share my screen here. All right. Well, thank you, Allison, and thanks to the Foundation for a Healthy Kentucky for inviting me back to further the conversation on public health transformation. Thanks to all of you for taking time out of your busy day to learn more about public health transformation. And above all, thanks to everyone in the healthcare and the public health fields who are tirelessly working to manage this second surge of COVID to keep your friends and your families, your communities, and all of Kentuckians as safe as possible. I think it goes without saying that for better or worse, it's an exciting time to be in public health. So today's talk is going to take a deeper dive into the purpose of public health transformation, what's happened over this past year as our Department for Public Health at the state and local health departments across the state have undergone a fairly intense planning phase, even during this COVID response time, and also just talk about some lessons that we've learned throughout the COVID response that really indicated to us that we really can't wait to move forward with public health transformation until all of this is over. We have to really act now. So I just wanted to go over the objectives with you for today. We actually developed these objectives the afternoon after my last talk in June because there seemed to be a lot that people still wanted to know about public health transformation. So I'm going to give just a brief recap of the purpose of public health transformation and what we've been through in the past year. Talk a little bit about the implementation plan and sort of the projected timeframes that we're trying to focus on, to review the goals and objectives within public health transformation, and really get more into why it's important to create this culture of public health transformation within Kentucky's public health system. So let's start with this, the original sort of this map that kind of launched the public health transformation initiative somewhat officially. And I always hate to show this map because I think that, you know, it kind of brings back some really tough times, especially at the local health department level. I think that probably most of you all have seen it. It was viewed in multiple news feeds across the state, and it really represents the pension crisis in Kentucky within the Kentucky Employee Retirement System, and how in 2018 the employer portion of the pension really rose exponentially, but beyond our comprehension. And it forced a lot of local health departments to either undergo layoffs or limit or eliminate programs or services, or both, or face closure if they didn't make those changes. But before that, there were other changes that led to some of this financial crisis that local health departments were facing. There were federal and state policies which, even though they allowed more Americans and thus Kentuckians to have access to healthcare coverage with both the Affordable Care Act and Medicaid expansion, the policies, while generally good, redirected a lot of individuals to a medical home or a primary care provider for many of those services that were once provided by the local health departments, services like well child exams, family planning services, women's cancer screening. And I think that there's a very trusted public health leader in Kentucky who always reminds us of these unintended consequences that are sometimes the result of good policies, but then there are some things that maybe are a negative to some of those good policies, and local health departments have had to experience a little bit of that. Another reason for public health transformation is this ongoing public health modernization that has been occurring for about the past 25 years. And for those few of us out there who remember when the Institute of Medicine, now known as the National Academy of Medicine, established this framework for public health, which is that circle that you see on the left, which really established sort of the essential services of public health. There were these three core functions of assurance, assessment, and policy development. And within that, these 10 essential services that really needed to define public health in terms of how we really needed to move forward. And then a little later in 2016, not that this visual on the right replaced the one on the left, but really more complemented a furthering of this restructuring of public health in order to address social, environmental, and economic conditions that affect health and health equity. And we call that Public Health 3.0, which was really launched by the Department for Health and Human Services along with the CDC. But I think that it goes without saying that probably the single most reason for importance of moving toward public health transformation is our health outcomes. You know, we've not had any significant improvements in our health outcomes for quite some time. In other words, you know, this idea that our health behaviors rank 48th in the United States right now, and health outcomes rank 46th is not new. We've remained in these high 40th rankings for quite some time. And so it goes without saying that public health transformation is important, because what we're doing now is just not working. As a country, as a state, as communities and individuals, we're not getting any healthier. And so we can't not change. These rankings, they're not acceptable to me. They're not acceptable to any of you. They're just not acceptable to be able to say that this is okay for the future of Kentucky. And so public health transformation is really Kentucky's own call to action to really work to create a more efficient, sustainable, and accountable public health system focused on producing better health outcomes for all Kentuckians. And when public health transformation was initially launched back in 2019, there were sort of three words that were sort of the driving factors in launching public health transformation. And those were simplify, focus, and prioritize. And so House Bill 129 was key legislation to really do just that, to really begin to look at public health, the programs, and how we could begin to categorize using this mantra of simplifying, focusing, and prioritizing. And so House Bill 129, also known as the Public Health Transformation Bill, led to amendments in KRS 211-185, which begin the prioritization of these specific programs into core and foundational. Core meaning this set of programs, including foundational public health, which are typically those programs that that local health departments are regulated to do, along with the emphasis on a community health assessment. And then within core public health, these other programs that typically local health departments have provided, like WIC and HANDS, and then those programs related to harm reduction and substance use disorder. And those are core, considered core, because it's really an all hands on deck when it comes to programs around harm reduction and substance use disorders, simply because of how this issue is really ravaging our state and our communities and our friends and family. And then there's this local public health priorities, which is where other programs that are offered typically by local health departments can begin to be prioritized. In other words, once there is an assurance that all of these core public health programs are offered, then through a local needs assessment, local health departments can determine these programs, the necessity to offer these programs within their communities. And a lot of people ask, so what's in the green box? What programs are you talking about when you talk about the green box? And in our work over the past year within the work groups and the subcommittees, we've identified, or at least taken initial stab at identifying what these local public health priorities are. And I think as you look over that list, you'll see programs that, yes, you know that these are programs that have been offered in local health departments before. And I don't want you to misunderstand that any of these programs are less important than those that are that fall within the core public health programs. They're all important. But what this has allowed us to do is to provide local health departments with the ability and the assurance of offering those core public health programs, and then through a local needs assessment, identify those priority programs that are needed in their communities. Again, going back to this idea of simplifying, focusing, and prioritizing allows local health departments and allows the Department for Public Health to support local health departments in focusing on those programs that are needed in their community, as opposed to trying to provide all of these programs. I can tell you, as a former public health director in the county where I served, in Montgomery County, we tried, we offered most of these programs. And so it really became kind of a matter of, the inch deep, mile wide type of programming, where we attempted to do all of these things, but not in a way that we were really making a significant impact in our communities. And so with public health transformation and with the legislation and the amendments in the statutes, then there is criteria to allow local health departments to perform this local needs assessment and really focus and prioritize on those top programs that they choose to offer. And so within that amendment of KRS 211-187, there were key terms that were introduced to help local health departments identify through this local needs assessment what programs were needed. And so KRS 211-187 introduced this criteria, which includes data-driven need. What important data do we need to consider if we're going to offer one of these programs? If we offer this program, are we using an evidence-based or a promising practice? is there adequate funding? What funding mechanisms can we put together to really focus on this particular program? Is this program part of a larger performance and quality management plan within the local health department? And then this idea of an exit strategy, which basically says that either if a local health department can no longer sustain this program, what is the plan if it's still needed to continue to offer this program within the community, or if through an assessment, it's determined that this is no longer a priority, then how are you notifying your communities that this program is no longer available? So we've talked a lot about this conceptual framework of public health transformation, and we've reviewed what's included in the public health transformation legislation. But what does public health transformation look like in practice? And I can tell you that this list changes, and I anticipate that it will continue to change as we continue with public health transformation. But I wanted to give you just some ideas, some examples of what public health transformation actually looks like. With regard to cancer screening, which was one of those programs that was listed on the previous slide, colon and breast and cervical cancer programs, what we're seeing is more contracts with FQHCs or university-based clinics. There's a focus, there's an emphasis on local health departments doing more outreach within those programs, and we're having those discussions with our federal partners on what that funding looks like. How do we define outreach, and then how do we fund it? The cancer screening program within colon and breast and cervical has expanded its partnership with Kentucky Cancer Link to provide a lot of that patient navigation that was once offered by local health departments. Programs like the adolescent health, diabetes, and tobacco programs, some of those have operated previously on a competitive grant process, but I think we're going to see more programs going in that direction where, again, based on community need, if this is a program that you need to offer in your community and there's a limited amount of funding available, then you can go through the grant process in order to receive some of that funding. Within pediatrics, right now, local health departments, either through their clinics within their local health departments or in school-based clinics, we offered a lot of pediatric assessment and well child services. Medicaid calls them EPSDT services, but we're taking a look now at that whole program. When that was initiated and we really didn't have the providers available to do a lot of the well child exams, then we were able to create this expanded role nurse within the health department who could undergo this training and therefore be able to perform these services. This training program, we had contracted with the University of Louisville, and they have informed us as a result of some internal changes within U of L and Norton Healthcare that they can no longer offer this training. So it really forced us to kind of take a closer look at why this program was put into place many years ago. Do we want to automatically just find another provider of the training, or do we really want to look at the training a little more purposefully and determine how we need to move forward, keeping in mind as we move through public health transformation. In family planning, we've seen major changes in how we offer that program in our communities. Again, we've seen an increase in contracts with FQHCs and university-based clinics, sometimes hospital-based clinics who are offering that. We also are not opposed to an assurance option, which is basically, if you have providers in your community who are willing to see the uninsured clientele that once received those services in the local health department, but they really don't want to have to provide the data and have really declined having any type of Title X funding, but they have agreed to see those patients, then that's what we refer to as an assurance option. Again, there's a higher focus on outreach and what does that look like? And much like the pediatric assessment and well child training, the comprehensive reproductive exam training, we also called it CRET, then our providers of that training informed us that they would no longer offer that. So it allowed us to take a step back and say, okay, when we initiated that training, what was the purpose? Is that still relevant today, or do we need to change that training? And as a result, we have tweaked that training, and it has more of an STD, STI focus for that expanded role nurse. And then in looking at school health, you're seeing, I know we were in school health in Montgomery County a couple of times, and as a result of managed care, then it became cost prohibitive for us to do that. But we're now starting to see this sort of surge of FQHCs getting into the school-based clinic business. And so they can go into schools with a more comprehensive scope of practice than what we were able to as local health departments. So I view public health transformation as sort of like peeling back the onion. It requires us to really take a hard look at many of these programs funded through the state and provided by local health departments to determine what the current relevance is, what are the required resources right now, and what are the potential benefits that we need to realize from these programs in order to continue to offer them at the local level. And we do this in a number of ways. We do this by collecting data and information. It's very intentional in trying to bring all of the information to the table. We bring the appropriate individuals to the table. In most cases, then there are people from DPH and local health departments who are asking the hard questions and having these difficult conversations with the goal of reaching consensus on how we move forward under this lens of public health transformation. The timeline that we are working on right now, and I'm not going to lie, it kind of gets moved as COVID has ramped back up and our resources are certainly pulled in that direction right now. But this is the public health transformation timeline that we're working on. It's a very high level timeline. As I've said before, most of you know, public health transformation officially kicked off in 2019. It was introduced by then Commissioner Dr. Jeff Howard. We also were able to get the bill sponsored and go to the legislative session in 2019, where because it did have an emergency clause in it, we were able to get it passed in 2019. There were white papers that were initiated by a group of local health department directors. There was the continued pension assistance for local health departments, which took a little bit of the stress off from just that reaction to the pension. And then we relaunched it in October of 2020. Now, most of you know, we had some pretty significant changes in leadership throughout 2019. And Dr. Stack started in February of 2020, and he had been given an overview of public health transformation. He was on board with it. And then, of course, we all know what happened in early March, which really kind of took us all offline. But I think that even at the height of the pandemic, and maybe even in spite of it, he, along with his other senior leadership, realized that we really had to get public health transformation back on board, and we had to push forward for change. And so the relaunch also emphasized that public health transformation is really a statewide initiative. It's not just a directive intended to rescue local health departments from this financial crisis, which is certainly definitely needed, but more of a modernization of public health at both the state and the local level. And I'm happy to report that I think we concluded a fairly successful and productive planning phase. We did make some changes, and I'll share just a brief list with you here in a few minutes about what changes have been made, but there's also been many work plans which have been developed and that will result in the new goals and objectives for our new strategic plan, as well as this continued intensive review and collaboration in modernizing public health. I'm hopeful that the next phase will commence next month in September, which will roll out this newly approved strategic plan for Kentucky's Department for Public Health and integrates much of this work from the past year as we move forward. Hopefully, creating this culture of change where change is embraced and not feared, and collective input is welcome and not dismissed. So these are the goals of public health transformation, which were actually established early on in 2019 when it was first introduced. Ensure equitable access to public health services across the Commonwealth, this increased focus on population health, fiscal responsibility, strengthened partnerships and collaboration, and optimization of internal capacity. And so in sharing the original public health transformation goals, I want to follow that up by also sharing Kentucky's strategic map. I apologize if you can't see this very well, but really what I wanted to focus on here is that even over the past year, as we've continued this intensive review and planning process, there's been this overarching challenge to ensure that these efforts would also result in an updated strategic plan. KDPH's strategic plan was due to be revised. The plan currently, we're working on the draft of the new one, but it currently expired in last year. It was 2017 to 2020. And so we wanted to use we wanted to make sure that we integrated public health transformation into this new iteration of the strategic plan. And so we used the work groups throughout public health transformation as the tool or the process really to drive the strategic planning, which will lead to this updated strategic map. I think that it's reassuring that this map was actually initiated in 2011. And so you can see that the Kentucky Department for Public Health has really had a rich history of strategic planning. And while it's been tweaked along the way, it's remained committed to these 4 strategic priorities: people, quality, efficiency and effectiveness, and building public health capacity. And so if you remember the slide before where it talked about the goals of public health transformation, and you look at these strategic priorities within the strategic map, I think you can start to see that public health transformation and the strategic planning really start to be in alignment. They really start to converge into this, this strategic plan for public health in Kentucky. And I want to point out that this new proposed version of the strategic map has a more widespread commitment to promoting health equity in all we do, which is another priority for all of us in public health. I shared this visual with you last time when I presented in June, and I really wanted to share it with you again as we begin to talk about moving toward creating this culture of change, moving public health transformation from planning into implementation. For those of you who have been involved with quality improvement, accreditation, performance management, I think that you'll agree that public health transformation will be probably the most comprehensive strategic quality improvement initiative that most of us will experience in public health in Kentucky. So with that, I think that I have to continue to emphasize that this massive of a strategic initiative is going to require this strategic mindset. And what I mean by that is basically what it says here on the slide is if you think in terms of visionary and in terms of more of a long-term approach, a dynamic view, then that will lead to actions that are more geared toward interventions and policy change, looking at infrastructure and this expansion of our partners and our network. And hopefully those actions that we take that are related to that will get the results that we want, which is this sustainable and certainly transformational public health system in Kentucky. And going along with just this idea of this culture of transformation, we're really trying to move this somewhat process that we've been doing for the past year of planning and work groups into more of a culture that we're really, when we think about what is public health transformation moving forward, then we have to think beyond our current program or grant-driven platform and how we deliver services to more of a comprehensive and a holistic approach to public health. We have to look at all of the direct patient care services that we offer and evaluate those, and also continue to move a lot of what we're doing into population health. Sometimes we have to look at ourselves where we were once providers of certain services to more of a partner role in identifying other partners within the community that we can work with to deliver some of the services that had once been delivered in the local health department. We certainly have to apply this lens of health equity in all that we do. There has to be an intentional emphasis on communication, both internally and externally, and we need to remain transparent to the ideas and the plans that we put forth and make sure that we are bringing people to the table and keeping people informed along the way. And public health transformation really is moving this whole process into more of a performance management, quality improvement model of identifying areas that we really need to take a closer look at and ask the right questions in order to get to the programs that are going to impact that change and ultimately improve health outcomes. So just a little bit about the progress that we've made to date. This is a growing list, and certainly one that has been a lot of work in action, but leads to a lot more work in the future as we move forward. As I've said before, we are sort of wrapping up this kind of structured, organized planning phase. We're finalizing these work plans. It was very humbling to know that there were over 100 staff involved in this process, both at the state and local levels, which was important to all of this work. We did go through the process of at least taking an initial stab at identifying what falls in the green box. What are those local public health priority programs that need to be followed up with a local needs assessment, and what does that look like? We underwent a revised local health department budget review process for fiscal year 22, taking into consideration those local public health priorities and how funding is allocated according to those categories of programs. And we're going to continue to develop that process because we're not there yet. We still have more work to do in assisting local health departments in identifying those local public health priorities and how to fund them. We have almost completed the new iteration of the state's strategic plan, which will, we put a date on it, 2021 to 2025, because it's supposed to be a 5-year plan, but we know that it needs to be reviewed as we go through this process. There are ongoing public health transformation initiatives, meetings going on where we're still taking a look at a lot of these programs. And as I said, we're peeling back the onions and putting a lot of information on the table and having a lot of conversations. We have enhanced a lot of our communication tools and continue to do so. I really hope to be able to share a website with you soon, along with some other resources and tools that can be accessed through that website. There's a public health transformation team that is focused on performance management, accountability, and transparency. We're starting to look at some of the COVID relief funding in in looking at workforce development and infrastructure and staffing, that while it still needs to focus on strengthening our ability to respond to COVID and other types of public health events like that, then we want it, we still want it to be in line with public health transformation and the direction that we're going with that. As I've said before, we've certainly increased and enhanced partnerships with some of our partners like the Kentucky Primary Care Association, the foundation here today, certainly have come to know a lot of FQHCs and the services that they do, and some of the university and hospital-based primary care clinics in providing services, and still focusing all the while on moving this public health transformation forward in creating this culture of change. So as I kind of wrap up, and you know, as we continue to have these conversations and unpacking public health transformation, I think that it continues to confirm that this is a very complex set of processes and initiatives as we move Kentucky toward redefining public health. We're not the only state that's undergone or is undergoing such a massive modernization effort, and we've learned from other states like Oregon, Colorado, New Mexico. We were able to have a call with some other states this past Friday, and Hawaii was on there. So I thought that was kind of cool. I was tempted to ask them if they had any openings, but I didn't. So, so anyway, we are learning and we are sharing experiences with other states. There's been talk about a continued conversation about public health transformation, but I'm going to suggest that you probably are tired of hearing from me. And I think that probably the next time that we come together and talk about transformation, then I hope that we can have a panel of individuals who can share how public health transformation has impacted the work that they do and how they see public health transformation moving forward, whether it's some of the directors from the local health departments or some of the leadership or program staff from DPH, or even some of our new partners that have joined us in this effort of public health transformation. So that's all I have for you today, and I'm happy to answer questions. Allison, I haven't kept an eye on the chat, so.
Yes. Thank you, Jan, for this discussion and insight. We very much appreciate the Kentucky Department of Public Health's response to COVID-19. I know you all been working very hard, but most, I think it's just amazing that to keep this work going in the midst of your pandemic response. So thank you for that. I am ready. If you have some questions for Jan, please type them in the chat, and we will read those to her and allow for any insight or extra information that you might need. While I'm waiting for those chats to come in, Jan, I very much will take you up on that offer to continue the public health transformation talk. I think it's a great idea to plan for, either early winter, maybe late winter panel discussion as we move through the progress of public health transformation. So first question, Jan, is how are you all defining population health?
Wow. So population health, when I think of it in terms of public health, I think of it more in terms of those types of social and environmental forums that we can impact, whether it's promoting policy that will improve public health, or whether it's looking at built environments to impact health outcomes. So I think population health would be more towards those programs intended to really overhaul societal behaviors in making our communities and our individuals healthier, as opposed to some of those direct patient care, one-on-one types of services. I know
Thanks.
there's a
So,
bigger definition for that.
thanks. And what about, have you all discussed any part of data infrastructure updates as part of public health transformation?
Yes. As you know, health data is it's an enormous part of public health. And we have a lot of data systems. Unfortunately, we have a lot of data systems that struggle to talk to each other. And so there is a subgroup that had taken on health data, and they quickly realized that it was such a massive undertaking that they broke it down into 3 sort of more defined health data subgroups. And so those subgroups are continuing to define what is within the scope of their work plan and how can they impact that. And those work groups are just looking at all of the health systems, all of the data systems that we have. That's one, and trying to determine, are there better systems? Are there systems that we can purchase or refine existing systems that interface better, that get us better data? There's a work group that's looking at technical assistance, just teaching people about the different systems and how to input the data correctly and what the data can tell you, how you can design reports out of it so that you can get data that you need in order to help make decisions. And then there's this third group that's really supporting the cabinet level electronic health record project and moving forward. And that project it kicked off a few months ago, and they're still in the, they've collected a lot of information. It is, like I said, it is a cabinet level project. And so they're trying to determine what that looks like, not just from public health, but from Medicaid, from the Department for Behavioral, BDID. And so they're pulling all of that together and trying to construct or write a request for proposal, which I think will come out within the next couple of months or so. So that's a very long-term project. I think we all agree that we need an EHR, and we really needed it yesterday. And I know that there are several local health departments that are moving in the direction of an EHR, but we are looking at it at the state, and that's a step. So yes, we are looking at health data.
Thanks. And then one last question I have in front of me right now is, what is the reaction from the people you serve as you make these changes?
I think that, at least from the level of our conversations and the work that has occurred in a lot of the work groups and the subcommittees within this planning process, I think that we have experienced this hopefulness that that at least we're bringing the right people to the table to have these conversations. I think that there's still, we still have a lot of work to do in really explaining the intent of public health transformation and why it's important, which is why I always welcome the opportunity to talk about public health transformation to groups, because it really is, it's a very complex set of initiatives to modernize public health in Kentucky. And a lot of people want to know why. They want to know why, and they want to know how it's going to impact them. And so I think that the more we can have these conversations of why it's important and how it will impact them, and assurance that, you know, we're not, we really are trying to move the state's needle for better health. And hopefully this is the way that we can do that. And it's not going to happen overnight. I mean, this is sort of an evolving process in moving forward. So it is an exciting time, but it's also a scary time, and I understand that. And I think oftentimes fear is lessened when we can talk about it.
Thanks, Jan. And I think I don't have any other questions in the chat, so I'll give just a few, just a minute if you have any last minute questions. But thinking about the population health question, Jan, in response to partnerships that we have, I know there's different areas and definitions of population health, but I think about it from the foundation perspective of moving that Kentucky health needle and encompassing population health, but also understanding that there's got to be different focuses or different areas of change within each population, within the Kentucky population. So when I think about public health transformation and the equitable funding of public health systems, it allows for that local approach or that county-wide approach with being able to identify where those needs are so that the overall population health can be improved. And so we're focusing resources to get the most bang for our buck, I guess, if you look at it. So understanding the massive undertaking it is to transform anything. When you're starting, when you're just transforming something, it takes a long time to do. And so I think we've all heard Kentucky didn't get here overnight, and we're surely not going to get out of it overnight. So the approach of bringing communities together through community health assessments and collaboration is of the utmost importance as we're moving forward. So Jan, again, thank you for your presentation. And we got one more question. Could you, I just lost it. Could you elaborate a bit more on the outreach focus related to cancer screenings? How do you envision a significant change? That's a good question. Yeah. Sure.
And Maria, it's good to hear from you. Maria and I go back a long way to UK days. So I think we're already realizing a lot of the benefit of outreach within cancer screening just by expanding our partnership with Kentucky Cancer Link, with the patient navigation piece, and really looking at how they can outreach to, they have sort of a focus on cancer, and just by virtue of the name Kentucky Cancer Link, then they can link patients who have been, who either need to be screened or have been screened and diagnosed and need all of those resources to deal with their diagnosis and their treatment. So that the outreach piece of it is really sharing with, identifying additional partners and sharing with those partners what the cancer screening program can do, how we can work with them, how we can improve access to those high-risk populations who need to be screened. Outreach in my mind moves beyond the walls of the health department and the walls of the state health department in reaching populations who are maybe difficult to reach, and just finding creative ways to do that.
Thank you, Jan. Okay, in closing, I want to thank all of you for taking the time out of your busy day to be here with us. We know you're fighting on the front lines of COVID-19 pandemic, and this current surge is taking much of your attention. So again, thank you for that time. We want you to know that we are here, there beside you, working to get more Kentuckians vaccinated. In fact, this week we distributed new graphics and a flyer that directly addresses myths about the vaccines, and we'll share that link in the chat box. So feel free to download and share however you see fit. And also let us know if there's any way that we can lend more support to you at the local level. The foundation is here to support efforts to improve and meet those unmet health needs of Kentuckians. Additionally, I want to make sure you all know about our upcoming Howard L. Bose Memorial Health Policy Forum that is set for September 20th and 21st. It will focus on Kentucky vaccine policy in the face of rising hesitancy for general vaccines as well as the COVID vaccine. So we're looking forward to our speakers, which include U.S. Health and Human Services Secretary Javier Becerra and Kentucky's Public Health Commissioner, Dr. Stephen Stack. The virtual event is free, but registration is required. And so we'll drop that link in the chat. And you also know that you can find more information on our website at healthy-ky.org. And lastly, we know that you all are doing incredible work. So we invite you to nominate those people you know who are making a difference in health policy across our Commonwealth for the health of Kentucky. So we please nominate them for the Healthy Kentucky Policy Champions Award. We here at the foundation would love to recognize them. And you can find more details about nominating someone for the Kentucky Health Policy Award, again, on our website at healthy-ky.org. Again, thank you all so much, and please feel free to reach out to us with any questions. Take care and have a wonderful day.